Why is prophylactic mastectomy an option for BRCA1 BRCA2? Imagine knowing that your chances of developing breast cancer are much higher than average. For women with certain gene mutations, like BRCA1 or BRCA2, this is a reality. These mutations significantly increase the risk of breast cancer, with some women facing a lifetime risk of over 60% by age 70. That means most women with these mutations will develop breast cancer if no preventive steps are taken. Prophylactic mastectomy is a surgical procedure that involves removing one or both breasts before any cancer appears. It is considered an effective risk reduction strategy for women with BRCA1 or BRCA2 mutations. Studies show that this surgery can lower the chance of developing breast cancer by up to 95%. While it cannot eliminate the risk entirely because some cells might remain, it offers a substantial decrease in the likelihood of cancer developing later in life. Timing is important when it comes to this surgery. Women often choose to have a prophylactic mastectomy in their 20s or 30s, especially before age 40. Doing so can add years to their life expectancy and reduce the risk of cancer at a younger age. The earlier the procedure, the greater the potential benefit. However, as women age beyond 60, the benefit becomes smaller, and the decision must be carefully weighed with medical guidance. It is important to note that prophylactic mastectomy is not recommended for women at average risk of breast cancer or those with only a slight increase in risk. Because the surgery involves significant physical and emotional considerations, it is reserved for women with very high risk, such as those carrying BRCA1 or BRCA2 mutations. The decision to undergo this surgery is deeply personal and should be made after thorough discussions with healthcare professionals. They will consider individual risk factors, family history, and personal preferences to help guide the choice. In summary, women with BRCA1 or BRCA2 mutations often see prophylactic mastectomy as a way to dramatically lower their chances of developing breast cancer. It offers the most effective risk reduction available and can improve overall life expectancy. But because it is a major surgery with potential risks and impacts, it is essential to approach this decision with careful medical advice and personal reflection. Always consult healthcare professionals to understand the full picture and make the choice that best fits your individual health journey.